What's going to happen?
Extra time to practice it. It won't take me very long to go ahead and actually do everything or go over everything. First one we have is elbow compression sleeve. So this is one where we can either use our good old neoprene sleeves, just like what we use for our knee, or we can use the white compressionette stocking. I forgot to grab some of those, but same thing, compressionette, measure where your distance is, cut it to size, and they can slip it on. Sizing for neoprene sleeves are usually circumferences of about mid bicep, mid forearm. Otherwise, you just slip one on. If it's too loose, it needs to get smaller. If it's too big, go smaller. If it's too small, go bigger, obviously. So a couple of different types. These are our typical neoprene sleeves that we have here. We also have this guy that's just kind of like a stretchier band. Maybe not applies as much of a compressionette or as durable as what our neoprene sleeves would be. Other options that we do have are elbow sleeves with some type of padding on it. Okay, probably seen plenty of these. Got different options for those. I think these are the same. Sizing of the padding is a little different depending on what kind of sport you are doing or what type of position you are in and how much padding you actually need. If you actually watch, most of our volleyball girls have elbow arm sleeves that have padding on their elbows, so when they go and dive, they can catch themselves. So you see a lot of them. I think some wrestlers a lot of times wears elbow pads once in a while. Football players. Then you'll see basketball players either with like the shooting sleeves. Sometimes they have the hex pads on them and sometimes they don't. Otherwise, baseball, softball players sometimes wear throwing sleeves, those kind of things too. Those are just more to keep it nice and warm, or that they get the feeling of keeping their arm warm while they're either throwing, shooting, whatever it might be. So just whatever options you want. If you're actually just looking for something tight and comfortable, or if you want something with padding, those are just multiple different options you can choose for a compression sleeve on your elbow. So predominantly, if there's swelling, we're trying to get swelling out or keep swelling out, or some type of padding to protect the elbow from hitting, either on people, hitting on the ground, whatever it might be.
Not really any support though.
No. Nope, just nice, tight compression. So no actual lateral support of any means. And you're not preventing any type of movement. Okay. Figure of 8 elbow pad. And I forgot to grab an extra pad. So this is going to be one I need just someone to demonstrate on. Sorry, I forgot to grab some extra padding. Okay. So anytime we're putting something and padding on it would be the same thing if we keep hitting our elbow on something, on someone, whatever, we're having pain on their Olecranon process, or we have some type of bursitis going on, so we have a lot of extra swelling. We're going to put an extra pad on the back and use our ACE wrap to be able to wrap up there. So I'm just going to give it a little bit bending. I know the book shows they put like an under layer of pre-wrap or something under it. Your choice, or depending on what the actual situation is, if you want to put a base layer on or not, that's completely up to you or completely up to the athlete, whatever the situation might be. Okay, so we're going to start, we're going to wrap around once. So imagine we have a pad here. I'm just going to put one X, half of X over, wrap around our bicep, come around once, and then I'm going to put the other X around. So we're just going to kind of repeat that as many times as you deem is necessary that the pad is actually going to stay, or until your ACE wrap runs out. So once again, we're going to either end on the bicep or end on the forearm. We're not going to end our ACE wrap on at the X, because then there's going to be no good way to tie it off or end it or wrap it. Make any sense? So we have a good old X, our figure of 8, as we've done on multiple of our body parts already, just to be able to hold that pad in. We do kind of a figure of X, so we kind of leave this opening here. So as we get too wrapped up here, a lot of times it gets into that crinkle of the elbow and it starts becoming annoying. I do this a lot too if I have an elbow or somebody that's bleeding. So especially in a basketball game, all of a sudden they're bleeding, like on the back of the elbow. I'm not just going to take my power flex and wrap through the middle of the elbow, because that's going to annoy them through where they bend it. So I'll do like a figure of 8 on them too and try and create an X on the back wherever I'm holding on either a gauze pad or whatever it might be. So you can use this technique on more things rather than just an ACE wrap holding a pad on there. Okay, pretty simple. I got one more. Hold on. One more. Next one is just a compression wrap. I'm just gonna grab another one. I brought a couple of different sizes of A-straps, so you can try different sizes of how you want to do your compression. I got some 4-inch singles. I think I just have some 4-inch doubles, and then I think that's like a 3-inch, bigger than a 2. Either way, so try with different A-straps that you have, different sizes. So just a compression wrap. So say you're on the road, you don't have a compression net stocking with you, you don't have an actual compression sleeve or neoprene sleeve, but she's got some swelling in there, so we need to try and get it out. The only thing I have in my kit is an A-strap. Okay. So same as anything else that we're starting distal to where the actual swelling might be, starting a little tighter and loosening up. The book shows following a little bit of an X pattern. If you want to do an X pattern, you can. I guess that's like our X whatever. If you just want to wrap around it, I'm fine with that. There's no real good or wrong way to do that. So as long as I work my way proximal up the arm, I'm just gonna loosen it up. I know you can't see me loosening it up, but we start tight and get looser as we proximal because we're taking that swelling, trying to push it up into the body. Okay. Pretty simple, pretty straightforward. We've done it before on our lower leg, did it on our ankle. So same concept, just obviously a different body part that we're trying to get the swelling on the area. A counterforce brace. So counterforce braces, we don't have a really good one, so we don't really have any in the AT room. So if you think of our patellar tendon strap for our knee, same principle, except we're going on our elbow, either for our medial epicondylitis or our lateral epicondylitis, okay? So we just have a couple of straps, like this one, you can see it's just an easy strap. It doesn't have any actual padding or bolster or anything in there that's gonna push on our tendon. But the concept's always the same. Go ahead and see if I can even get this through on myself. Either way, so strap it tight, just distal to the elbow, make sure it's tight enough so it's putting pressure either on their medial or their lateral epicondyle, wherever they're having their pain. Okay. Let's see. This is a different one that we have here. So this one you can actually see, if you can actually see it or not, has like a gel, or it's actually more of a hard plastic piece. So you would actually put that over top over those tendons connect. So whether it's a medial epicondylitis or lateral epicondylitis. Okay. Which muscles flex and pronate your elbow? Which side or which medial or lateral do they connect to?
Wrist or
Wrist.
elbow?
Of the wrist. So my flexors and pronators, which side of the elbow do they connect to?
Medial.
Medial. Our extenders and supinators connect to our lateral. Okay, so when we're thinking about our sports, if we have lateral, or we'll say if we're a tennis player and we're constantly doing this motion, what are we going to end up having issues with? Lateral epicondylitis. Yep, our supinators and our extensors. If we have a golfer, so we're coming through here, or we have a baseball player coming through here, what are we going to have issues with? Medial epicondylitis. Okay, so know what sport they play, know what position they play, hence why they might start having those issues either on the medial or lateral side of their elbow. So we get these straps like this. I have made homemade straps, just like when we make the pre-wrap straps for our knee, done it with the elbow too. Same concept, wrap it around a couple times, roll it up. It does put the pressure on both sides, which is fine, right? But then instead, be able to give them a homemade one to find out, hey, is this helping you? Does this work? Before they either purchase a strap or you give them some type of strap. Make sense? So you can make homemade elbow tendon straps just like you would a patellar tendon strap. So you guys can practice making those too. Okay. What do we got? Rehab brace, rehabilitative brace. Okay, so these are going to be very similar to our long hinge knee braces. Okay, should look familiar, right? From what we do with our knee. This is just a unilateral one. So obviously this is only going to work on my left arm. Okay, because because I can't put it on if I have it on my right arm, that's not gonna quite work. They do make bilateral ones. Same thing, you can adjust how much resistance, or sorry, not your resistance, your angle that you are able to have. You can adjust how long you create them. I think I just got to pop this guy out. So just like our long hinged brace for our knees, this can also be considered a long hinged brace for your elbow, or a post-operative rehabilitative brace, right? So we just strap it on. These really aren't custom. Same thing, you kind of just measure their distance of their arm, and you can adjust the length to be able what size you need to buy. I think these are mostly one size. You know, I don't think I don't have too many of them. This is literally the only. We have 2 of them. We don't get many of these back. The other one we have is like this. I don't even know if this has ever really been used, but you can tell this is even a little older style too. It's got a little older dial on it. A little more flimsy than what this guy is, but these are the only 2 that we have between in the AT room and in the football room. Okay, so we don't get too many of them. I don't think we've had too many elbow surgeries in the past few years, so that helps. Knock on wood. Not even with things. Even with baseball, I can have to ask Ashley how many like UCL surgeries she's had, but that's our primary elbow surgeries that we would have had is usually UCL reconstruction, which predominantly happens in our baseball team. So those are rehabilitative. The next one is either elbow hyperextension and functional elbow brace. So I put obviously on your sheets, it doesn't say that. When you pull up your like actual pages that shows the pictures and everything, I actually added in there functional braces because it's both pictures are on there. Does that make sense? Like the top half talks about the hyperextension, the bottom half talks more about the functional braces. Okay. Hyperextension braces look, the ones that we have at least look predominantly like a sleeve, just a compression sleeve. Let's see if I can even, if this will fit my arm or not. Ooh, a little tight. But anyways, so it pulls up, making sure basically the middle of the brace is where your elbow actually bends. We're taking our straps. Sorry, I'm moving around on you.
You're fine.
Coming through. Okay, so once again, you're finding where that comfortable range of motion is. So we want pain-free range of motion. So the tighter we go, the less extension that you're going to be able to give them. Okay, so you can, so see now I can't, even if it's not fitting properly, I can't get my elbow completely straight. So the tighter you go, the less mobility that you're able to give them. Okay, so which also can be achieved with our long hinge brace because you just block out whatever range of motion you need them to. So depending if they need to be more functional and actually play, you put them in more one of these. If we're limiting range of motion due to surgery, they'd be in one of these guys. Okay. Get it off. So we got a couple of those. I think this is the same thing. Yep. Yeah, I'll get to those. Our functional elbow braces look like this. What do these guys remind you of?
The functional knee.
Functional knee braces, right? Basically the same concept, and so we go ahead and strap in there. So this one's probably, it might not be too bad for me. And then go ahead and same thing, strap them up. I got a little bit of extra room around the forearm. Predominantly use these for our football players. So true or false, can you use a knee brace as an elbow brace?
Yes, I think you can, yeah.
True. Yep. Yep. So depends on the player, but yes. So you have a big, beefy football player. More than likely, they're going to fit into a small knee brace, which is completely acceptable. Say what you're trying to prevent is a lot of excess rotation, and with the hinges, you're also preventing medial or valgus and varus forces on those elbows. So yes, you can use an elbow or a knee brace on an elbow, but going to be dependent on your player, position, and size. So obviously, I'm not going to put even a small knee brace isn't going to fit one of my volleyball players. You know, it's still going to be too big for her. So I would get a true, a true elbow brace for them. But you get a bigger lineman football player, heck yes, if I've got extra small braces laying around, let's try it. See how it fits them and make sure, it's sliding around or shifting side to side, slide up or down, those kind of things. But these would be, yes, functional. So this is something I would put them into to actually play in a game. Okay. So I got a couple of different ones of those. And this actually is a knee brace. Okay. This is a small fusion knee brace. Tiny. So this is like junior high female volleyball player.
Like, I don't think my knee has ever been that skinny.
No, mine either. Exactly. So, but then even then, it's still pretty small. So it still would have to be a smaller elbow to put it on, whatever. But yes, this is a true knee brace. Okay. So I got a few of these up here, so you can go ahead and try those on, strap them on, see if they fit. So those are functional braces. Okay, last one is elbow collateral brace. So just like our knee, these are the ones with the hinges. So hinges, I say we have our good neoprene sleeve, and then we just got the hinges on the side. Okay, these I think all of our actual hinge braces can also be utilized as a hyperextension brace. Okay, they've all got the straps here too. Obviously, if I put this on, same thing, again, too small. Okay, so I got this bends here, but I also got my straps that come through in the front that will prevent me. If I'm not preventing any hyperextension, just put them through loosely so they're not dangling off. But otherwise, I got the side to side to protect those collateral ligaments. Okay, so I got 3 of those. This one actually comes with a little pad on the back of it too, so a little extra protection for that olecranon process. All these are kind of small, so I apologize. Any larger arms trying to try them on, but so I think all of the hinge braces that I found also can prevent hyperextension. You can buy them that they don't have the straps, and if you absolutely hate them, and there's that nobody else is going to use them, cut them off. So if they aren't used by everybody type of thing, and you can go ahead and just cut them off. They're never going to be used again for actual hyperextension activity. So, questions about braces? Cool. All right. So biggest thing is you got to try them on.